Hi, this is Jim Leffler. We will continue psychodynamic psychotherapy technique course and focusing on session 6. Today's topic is container contained. This was an idea put forward by W Bion. He's an interesting character. He was in World War I and served as a tank commander and in World War I, and actually received the Distinguished Service Cross as a British soldier. In World War II, he served as a psychiatrist, and along with another analyst, uh, Rickman, I think it was John Rickman, I could be wrong about that, they did some of the first work on examining groups, and these were groups of combat veterans who were suffering from shell shock and what we might describe today, I think, as PTSD. He himself, Bion, seems to have had elements of what we would describe today as PTSD and spent really the rest of his career trying to understand that. And one thought he came to was it seems like some emotional experiences, like watching a comrade die in combat or suffering other severe traumas or early childhood neglect or early childhood abuse or lack of emotional attunement by parents, leave permanent wounds on a person. And one way these are manifesting is people lacking an internal ability to be present to, learn from, understand, make sense of emotional experience. And he developed an idea of container contained. That was an idea between two people. Uh, the prototypical event being infant and mother, trying to make sense of the infant's experience. I think his ideas work well alongside of Winnicott's. If you've heard of Donald Winnicott, who was a pediatrician and came up with some other ideas called holding, this idea fits nicely in tandem with that, and the reading actually puts those two ideas together. But in review, first we did sessions 1 and 2. We were talking about listening and the conditions of what I like to think of as listening therapy, how you try to take the patient perspective and encourage them to freely share with you what's on their mind. Of course, there's limits to that, and there's never going to be totally free. And then the analyst, therapist, practitioner, person that's treating mental suffering also tries to listen openly without coming to foregone conclusions. Sessions 3 and 4 reviewed transference, countertransference, and we came to a point where perhaps we can think of them as a singular event occurring. Session 5 was taking projective identification, moving it from a defensive structure into seeing projective identification as a means of unconscious to unconscious communication, or a form of pre-verbal, nonverbal communicating, not just defending, and that might happen continuously in a transference countertransference situation between patients and professionals. And today we're going to think about how does something move from being evacuated to digestible. And we already talked about this a bit with Ogden's 1979 paper, who was borrowing on Bion's idea already, container contained. So a hypothetical patient arrives for their 6th visit. It's a 28-year-old female. She's a grade 2, second grade teacher, typically articulate, well organized. Today she comes in, even before she sits in the chair or lies on the couch, she's talking fast. She's telling you about a noise in her apartment she can't quite recognize or locate, a text from her mother that she hasn't answered in 9 days, a comment made from a student that continues to intrude upon her mind, and wondering if she even locked her car as she made her way up here to see you today. You're sitting there in the chair, you're feeling some pressure, you're having a hard time finding a thread, you're feeling scattered yourself. You feel really pulled to kind of slow her down and ask her to take it one item at a time so that you can keep up. She looks up and says, "Sorry, I'm everywhere today. Can you tell me what I should do or what to do?" Kind of some options. So some responses. You could offer and respond to that pull you're feeling internally and say, let's take them one at a time so that I can keep up because I'm feeling overwhelmed. And you can only imagine how overwhelmed the patient must be. 2, you can reassure, it's okay. You can take your time. 3, you could use that comment as content and ask a clarifying question about the comment, about the content. What do you think you should do? Or 4, hold space. Allow yourself to feel the unsettledness. See if an image arises that helps you make sense of the unsettledness, perhaps a metaphor. And you could utilize her commentary to then build a metaphor out of all of the different elements. Well, it sounds like there's noise, not just in the one place that you can't find, but in every wall, that there's no quiet in any room right now. This then offers back this frenzy in a digestible metaphor that perhaps the patient can make use of to make sense of what she's experiencing right now. So what is this? This is the idea of container contained. And Bion was trying to move away from, and he used words that had not been used in a psychoanalytic context before. And he also got kind of interested in math. So he got interested in symbolic math and high-level math. And so he uses symbols of female, male, but these symbols in his lexicon are container contained. And then he invents words, beta elements, alpha elements, and reverie is a word he doesn't necessarily define, but gets defined later by Ogden, who's a later kind of post-Bionian iconoclastic thinker, and then other post-Bionians, primarily in Italy, try to understand this reverie. But I'll try to walk through the diagram, and you can really enter at any point. But let me set the scene. So again, we have analyst, therapist, person in the emergency department, and a patient who comes in, they're overwhelmed. The scene has been set so that the patient is been encouraged to freely associate, and the analyst is attempting to hold evenly hovering attention, as we talked about before. So there's this noise, text, comment, and the patient is evacuating, expelling, maybe even vomiting out these beta elements. And within the Bionian context, beta elements are raw, unprocessed emotional experience. And they're trying to get rid of them. And those are absorbed into the room, into the patient, into the therapist, trying to keep their mind open, not defend against the influx of this difficultiness, allowing themselves to feel scattered, unable to keep up, and then allowing their reverie function, their alpha function, to take these unprocessed elements, make sense of it in a way that could be given back. Now, not everything you say is going to help someone be organized, help someone make sense of, help someone process. As we said last time, you could actually elevate somebody's anxieties, and if that happens, take note of it, and you can engage in a different way. But this will go into alpha elements that are then able to be thought about and thought from, and that is the context of alphabetization. And this entirety is the container and the contained. And you can even see many people will talk about how the couch itself can become a container that holds people and allows them to do this difficult work of alphabetizing raw emotional experience.